So ladies and gentlemen, we talk about these benefits of Rasashastra, and we need to have the concluded safety, efficacy, authenticity and standardized parameters. So Sri Dhootapapeshwar Limited has successfully concluded from the time tested to evidence-based medicine. Yes, they have done through their research and immense development, coordinating with the relevant institutions and so on and so forth. As the time is limited, let's open up the forum for the open session. And to three questions, right? Okay, so the first one I do have with me. Please explain the Rasashastra as it can be used in pediatrics. I think it's posed to Madam Acharya. From a personal cheat. Yes, one more.
So, I have mentioned before, Bala, it is very important from Swarna Prashana. In Kashyapa Samhita it says immediately after birth, Swarna Prashana is mentioned. I try to follow this in my center. Immediately after birth, if the area, everything is fine, I tell the father to put a drop of Swarna Prashana to the baby immediately after birth. Then I follow 6 months of Swarna Prashana, not that Pusha Nakshatra one. I tell them to start on Pusha Nakshatra and go for 6 months. This is also mentioned in Kashyapa Samhita. And many conditions of autism and ADHD and different conditions, we have beautiful medications, especially from Dhootapapeshwar Limited. I give this Swarna Mahayoga and Brahmi Yukta Swarna Yoga. That has proved. And one patient of mine, you must have heard of proseria. Proseria is like that baby is born and then immediately they brought to me. She couldn't come for this Garbhani Charya and before conception also because of the COVID. After that, because they both, the husband and wife, had some health problem. So I was expecting this. I told them to undergo this Garbha Sanskar. They didn't go and they had a proseria baby. And first one year he was not doing anything. Then with this Mahaswarna Yoga with Brahmi, he's responding to people. Last week also he had come to my clinic. He's trying to talk to people now. He's a 2-year-old now. So we have many Rasashadis we can give during this for children, especially in immunity. Even there Shishubharana Rasa I regularly give for a month or two because in Bangalore mostly children fall sick with cold, cough because of the pollution and cold weather. So Swarna Bhasma is the best for children. I hope.
Yes, thank you very much, madam. And moving to the next question. 20-year-old patient, diseases mitral valve prolapse and murmur. Can it be treated with Roga Chintamani Rasa or Makaradvaja?
Sir,
yes, sir. A 20-year-old patient, disease mitral valve prolapse and murmur. Can it be treated with Roga Chintamani Rasa or Makaradvaja?
Sir, I would like to answer this question. If it is an anatomical problem, you understand, okay? If
yes.
It is an anatomical problem, he might require correction supported by Bruhat Vanchintamani Ras, because then it should not be a very broad claim. If it is an anatomical problem, we have to fix it. Okay, means I have in my practice, I have not heard treating or correcting mitral valve. There might be
yes.
good doctors who might be doing it, but I have not heard it. If you ask my opinion, okay, if he requires correction followed by Rasayan therapy with Bruhat Chintamani Ras can definitely help.
If there's an anatomical correction, it need to be done. Right, yes. And proceeding to the final question to Dr. Yogesh Kulkarni, can you please explain the VKR in acceptable dose will reduce proteinuria and GFR in CKD stage 1?
No, as far as clinical dose of VKR is concerned, obviously it has shown some good effects in kidney. But again, we have to prove it scientifically by using the same doses, whether it can be useful in CKD or not. So I think a basic study is required for its effectiveness in CKD.
See, we are talking of treating CKD, or yes. We are talking of preventing CKD, because when we talk of CKD prevention, okay, the mode of action by which an NaCID damages the kidney and by the way the hyperglycemic damages the kidney, okay, it is different. When we are talking of, these are two different mode of action. When we are talking of preventive diabetes related chronic kidney disease, Vasant Kusumakar definitely works, and we can get n number of examples. Our Vaidyas are using it, but they are not documenting it. So this is definitely possible.
Yes. Right, okay. Thank you very much for those valuable insights. We need to wrap it up this open forum as we are running short of time.